some of my colleagues more locally to yourselves. So you may already have an idea about of what speech and language therapy is and what we do. But there are a few questions that I'm hoping to answer for you today. So the questions are, what is speech and language therapy? Why am I talking to you today? How does the swallow work? What is dysphagia and how is it managed? What is reflux and how is it managed? So speech and language therapists work with a wide array of people with a wide array of communication difficulties. We provide assessment and intervention for a range of speech, language and voice disorders. So this might be what you most typically think about when you hear about speech and language therapy. But we also work with people who have difficulty with their swallow. And this is because we understand how the mouth and the throat work for us to be able to both communicate and swallow effectively, and what we can do if anyone has a little bit of trouble with this. So I'm talking to you. A number of people with WS can experience difficulty with their swallow, and this may be because the brain through the muscles are disrupted, or because of an increased difficulty in coordinating breathing with swallowing, and it can also arise due to reduced coordination of movement or ataxia. So I'll be explaining how the swallow works, how you can identify particular swallowing difficulties, and how speech and language therapists can work with you to manage this. So I'll just take you through the normal swallow. This is made up of 4 different stages. We have the pre-oral stage, the oral stage, the pharyngeal stage, and the esophageal stage. So the pre-oral stage encompasses everything that happens before your food and drink reaches your mouth. This includes seeing and smelling your food and drink, producing enough saliva, using your hands to bring the item to your mouth, and using the muscles that control your lips and your jaw to open your mouth to receive the food and drink. Okay. Next we have the oral stage of swallowing, and this is everything that happens when the food and drink is inside your mouth. So we need to have a strong lip seal in order to stop anything falling out the front. And we need to use our tongue and other muscles to manipulate the food or drink to form a cohesive bolus and transfer it from the front of our mouth towards the back. And throughout this time, our airway is open and our soft palate, or our velum, just here, is lowered. Okay, and our airway is just here. I can send these out if the pictures are a little bit small. I can send these slides out after. Okay. All right, so we come on to the pharyngeal stage. So once the food or drink has been transferred towards the back of our mouth, a swallow is triggered, and this is no longer under voluntary control. So the pharyngeal phase is or reflexive or involuntary, whereas everything before this moment has been under voluntary control, and we've been consciously aware of what we've been doing. So once the swallow is triggered, our soft palate or velum rises up and seals off the nasal cavity from the oral cavity. Okay, just get my mouse just here. So this stops any food or drink going up into our nasal cavity and coming down through our nose. Okay. Our throats or our pharynx contract and push, and our pharynx contracts and our larynx rises up, closes off the airway. So this means we are holding our breath when we're swallowing. The muscle at the top of our esophagus relaxes and allows the bolus to pass down into the esophagus. Okay, so just come down here if you have a look through all these pictures. All right, and this moves us on to the esophageal stage of swallowing. Our airway is once open again, allowing us to breathe freely, And the muscles within our esophagus move in the formation of waves, and this is called peristalsis. The bolus is pushed down in a wave formation all the way down into our stomach. All right. So everything I've described so far is how a typical swallow works. Each stage of the swallow is important in order to trigger a swallow successfully. And an interruption at any of these stages may result in a less effective swallow, and this can be for a wide variety of reasons. So an interruption or difficulty in swallowing is known as dysphagia. That's the medical term. And dysphagia can occur at any stage of the swallow that I've just spoken about. So you can have oral dysphagia, pharyngeal dysphagia, or a combination of both, esophageal dysphagia. And signs or symptoms of this can include coughing when eating and drinking, choking, a wet or gurgly sounding voice after you've had a drink, repetitive chest infections, or aspiration pneumonia. So aspiration is when particles of food or drink go down into our windpipe rather than our food pipe, and they can sit in our lungs and cause an infection. So that's what aspiration pneumonia is. Other symptoms can also include pain on swallowing and the feeling of something stuck in the throat, and this can also lead to a reduced inclination to eat or drink. So you're not getting enough food or drink in because it's not a particularly pleasant experience. Some people may also notice that thicker drinks such as milkshakes or smoothies reduce some of these symptoms. So they might notice that they're coughing when they're having water or squash or tea, but if they have a smoothie or something a little bit thicker, it might reduce that coughing. And I'll come on to the reasons for that as well. So if somebody is experiencing symptoms of dysphagia, they'll likely be referred to a speech and language therapist. We will complete our assessment, and we'll have a look at how the muscles around the mouth and around the throat are moving, and see if we can gauge sort of reasons for the difficulties that are being experienced. So typically a speech and language therapist will assess an individual with various consistencies and textures of food and drink to determine the safest consistencies for that person. And the initial assessment involves observation and palpation. So we'll have a feel of how the swallow is moving. We'll just place our fingers on the front of somebody's neck so we can have a feel, see how much movement there is. And we'll observe for any other symptoms that are going on whilst eating and drinking. So we might notice that coughing occurs with certain types of food and drink, but not others. If we feel that a more objective assessment is required, we can use FEES, which is fibre optic endoscopic evaluation of swallowing. And this is where a small camera is put up your nose, and it hangs down sort of the back of your throat. And this is used to sort of see how the anatomy is moving and what the sensation is like, and how our swallow responds to food or drink. Okay, we can also use video fluoroscopy. So that's a moving X-ray of your swallow. So we get to see you from side on and see how the food or drink moves through your mouth and down your throat. And we can identify whether there's traces of aspiration happening, and we can also see if there's a difference between consistencies of food and drink, and whether any strategies are helpful as well during that assessment. So once we've identified what is happening, we can provide advice, strategies, and modify food and drink, aiming to make eating and drinking safer, easier, and more enjoyable. There is also the option of swallowing therapy, and this will be tailored to each individual after assessment. So we look at factors such as positioning, ensuring that the individual eating and drinking is in a comfortable and upright position as possible, and that they're able to use utensils well. So there's a wide range of adapted crockery and cutlery available, that can increase independence at mealtimes. This includes winged cups, weighted cutlery, non-slip mats and plate guards, and this is useful if dexterity is an issue. We can have a look at different options there. Postural strategies are also used to increase airway protection and avoid anterior loss when eating or drinking. So this can include turning your head to one side, tilting your head to either side and tucking your chin down to your chest. Manoeuvres and therapy exercises can be specifically advised for individuals after assessment, and it's important that these are only used if advised by your speech and language therapist, as while they're very helpful for some people, they can be very unhelpful for other people. Okay. So, as well as those options, food and drink can be modified to manage the symptoms that somebody is experiencing. And this means that we'll prepare food and drink to a certain consistency or texture. And there is an international standard for diet and fluid modification known as IDSI. That's the International Dysphagia Diet Standardization Initiative. And this framework describes different levels of food and drink and how they should be prepared to best suit the individual. Okay, so if swallowing is a very acute problem or something that's persisting for a little bit longer and somebody isn't able to manage the nutritional requirements through food and drink, we can look at non-oral nutrition. So this is something that nutrition nurses and dietitians will be involved with, and they look at tube feeding. So this can be a little tube that's placed through your nose, directly into your stomach or into your intestine in order for somebody to get the nutritional requirements. And this doesn't mean that they're not able to eat or drink at the same time. It can be for some people, can be the case for some people, but not for everybody. Just depends on the situation. And finally, surgical intervention can be used. So this will typically be under gastroenterology. So if somebody is having ongoing difficulties at the esophageal level, sometimes people can experience strictures or narrowings of the esophagus, and surgical procedures can be used to manage this. Okay. So I'm going to talk a bit more about diet and fluid modification and why we do this. So changing the consistency of someone's food and drink is useful and can compensate for any weakness or incoordination of muscles. It can make chewing, clearing your mouth and swallowing easier. It can increase somebody's independence and their quality of life. And it can also reduce any pain, any discomfort and risk of aspirational malnutrition. So this is the IDSI framework. It's quite a small image, so as I said, I can forward my slides on to Tracy, who can distribute after. And I've also included the link at the bottom of this screen, which explains everything in much more detail, but it's not relevant for everybody, so I'm not going to go through it in too much detail today, but it's there if required. So I'm going to take you through a brief explanation of each level for you. So firstly, we have level 0, which is thin fluids, your normal drinks. So just your water, tea, coffee, anything that flows quite quickly, and you can drink from any kind of cup, any kind of straw. We use thickening powder when we make thicker drinks, and I'll be showing you that later. Okay, so level 1 is slightly thick fluids, and this is very slightly thicker than water and requires a little more effort to drink through a straw, but you can still get it through a straw quite nicely. Level 2 is your mildly thick fluids, flows off a spoon but moves a little bit slower. It's sippable, and you can get it through a straw with a little bit more effort. Level 3 is your moderately thick fluids, and this also corresponds to a liquidized diet, so they'll be the same consistency. And this is something that can be drunk from a cup. It's very difficult to get this through a straw, very tricky. You can also have it from a spoon, so if you think of maybe consistency of of your average soup, maybe a canned soup, this will probably be about the consistency of a liquidized diet or moderately thick fluids. And it's important that it's nice and smooth with no lumps or bumps. Moving on to level 4, this is your extremely thick fluid and also your puree diet. So they'll be the same consistency. And it's hard to drink this from a cup. You're not going to get it through a straw, and it's usually had from a spoon. And if you were to pop it on your spoon and tilt your spoon, it would come off in one dollop. Nice and smooth, again, no lumps or bumps. It's also not sticky, and it doesn't require any chewing. So if you think of quite a thick yogurt texture, that would be your level 4. Level 5 is minced and moist diet. So as described, it's nice and soft, nice and moist. There's no separate thin liquid. There'll be some small lumps, and it has 4 millimeters wide specified for the adult population. But if you sort of picture a fork, the little lumps will be able to fit through the prongs of the fork, and they can be easily squashed with your tongue. So you need to do a little bit of chewing with this texture, but it's still very, very soft. Okay, moving on to level 6. So this is your soft and bite-sized diet texture. And as described, all food should be cut into nice bite-sized pieces, about the size of your thumbnail for a rough gauge. Again, the measurements I've got here are for the adult population, so that's 1.5 by 1.5 centimetres, the size of your thumbnail roughly, and they're a little bit smaller for paediatric populations. Again, the food is nice and soft and tender, no separate thin liquid or hard lumps, and it can be mashed or broken down with a fork, and you definitely need to do some chewing with this. Level 7 is your regular diet, so your normal everyday foods, various textures. They could be hard and crunchy, naturally softer, and there's no size limit. They can be mixed consistencies in this category as well. And there is also a group of foods that we label transitional food items. So these are foods that start as one texture. It can be firm or solid and change into another texture when moisture, so this could be water or your saliva, is applied, or when there is a change in temperature, so when the food becomes warmer in your mouth. So if you think about certain types of crisps, you have your Skips or Quavers. If you held them in your mouth for a while, they would melt down without any need to chew those. And your tongue can easily break those foods down once they've been altered by moisture or temperature. Okay. I'm just going to take you through some of the high-risk foods. So these are the food groups that people most typically have difficulty with. And I've definitely spoken to a few of you in clinic about this before. So they're foods that are most difficult to manipulate in your mouth and most difficult to swallow. So these will be stringy and fibrous textures. So picture your foods that have sort of strings running through them, like your pineapple, runner beans, celery and lettuce, as well as vegetable and fruit skins. So this includes beans and grapes. Mixed consistency foods. So these will be foods that have a solid component and a liquid component. So if you think about a soup that has lumps in it, or cereal that doesn't blend with the milk, so Weetabix can make a nice, it's a single consistency food once it's soaked, whereas your muesli isn't going to soak well with your milk, and you'll have those different consistencies. And it's just a trickier consistency to manipulate because we will swallow the milk first and then we'll have to manage the cereal that's left in our mouth. So it just requires a bit more coordination and good breath control. Then you've got your crunchy and crumbly foods and your hard foods, so toast, crusts, anything that that's dry, biscuits or crisps, boiled and chewy sweets, nuts and seeds, and finally your husks, so sweet corn, grains, granary bread. Okay, so I'm just going to stop my screen share in a minute and show you. Can you all see me again? Good. Okay, so I'm just going to show you how we can make a thickened drink. So this is the thickener that I most typically use, and it's a Nutricia product, Nutrilis Clear. I don't know whether this is actually the right way around for you or not, but it is. Okay, good. It's important that the thickener is a clear product. So there's plenty of different brands, but they will all have a clear product. And this is a thickener that's made with xanthan gum, and that's something we find in a lot of our food and drink that we can buy in the supermarket. It's just a binding agent. So the powder binds to the water or binds to the drink that you're thickening and makes it to the desired consistency. Other thickening products will be a powder instead of a clear product, and that is a starch-based thickener. And they thicken the drinks well, but if you imagine you've made a jug of gravy and you leave that jug of gravy on the side for half an hour or so, it's going to get quite thick because they thicken over time. So that also happens to the starch-based thickened drinks as well, and it's not going to be pleasant to drink if you come back to that half an hour later. The xanthan gum stays at the same consistency as it did at the start. You could leave it there for a couple of days and it would still be the same. And I might not recommend drinking it, but it would still look the same and be the same consistency. And it's also, we have a enzyme in our saliva called amylase, and that enzyme breaks down starch. So if we thickened a drink with starch, it would actually become thinner when we drink it, whereas clear products are resistant to that amylase, so it stays the same consistency during the drinking process. So I'm just going to show you how to thicken a drink. See if I can move my laptop a bit. I'll try not to spill anything anywhere as well. So what I've got here, I've got my cup that I'll be drinking from, and I've got 200 millilitres of water. Okay, so the measurements for each brand of thickener are different, but for this one everything is in proportion to 200 millilitres. So I'll be making a level 2 drink here, and for that, for this brand in particular, I'm going to need 2 scoops. So I've got my scoop here, pop it into my dry cup. If I was going to put it into a wet cup, it would start thickening straight away, and it would get quite lumpy. So I'm putting it into a dry cup that I'll be drinking from. So you can see on the back here, it has the level of fluid and how many scoops you need, and it will be different for different brands. But for level 2, I need 2 scoops of this product. And I've got my fork. You can use a spoon as well. I'll be mixing with a fork today. I'm just going to put my 200 millilitres in and start mixing. So I'll mix it for about 30 seconds, and then it will be the consistency that we're after. Right, so I'm just going to leave that for 30 seconds and then that'll be ready, and I'll show you the difference between a cup of water without thickener in that I've got here and this one, and you'll be able to see that it moves slower with the aim of giving the person who's drinking it more time to manipulate the water and enough time for their swallow to respond to the drink, so it goes down the way you want it to go. Okay, so this is my water without any thickener. Okay, and this is a level 2. Okay, so it's not too thick, but you can see that difference. Okay, and it changes the color very slightly, and it changes the consistency, and that's what we're after, but it's tasteless. The xanthan gum doesn't taste. The starch based thickeners will have a sort of starchy taste, like a sort of pasta water kind of taste. So that's another reason why I'm more of an advocate for the clear based thickener. All right. Let's go back to my shared screen. Here we are. Okay. So there are various symptoms of WS that can lend themselves to disrupting the eating, drinking and swallowing process. If we think back to the 4 stages of the swallow that I described, the pre-oral stage requires or utilizes your vision and your smell, and optic atrophy is a symptom of Wolfram syndrome, so that it can impact that stage a little bit. Ataxia as well, so your movement could disrupt sort of the physical act of eating and drinking, bringing the food or drink to your mouth, but also the coordination of the swallow itself. And there are also a lot of people that I've spoken to in clinic who describe gastrointestinal issues. This includes acid reflux, which I will be coming on to next. Okay, so what is reflux? Reflux is the backflow of gastric juice and enzymes from the stomach into the esophagus, and sometimes the throat as well. There are 2 main types of reflux: your gastroesophageal reflux, which is most commonly associated with heartburn and indigestion symptoms, and extraesophageal reflux, which includes laryngopharyngeal reflux, where it comes right up to your throat and can affect your throat and your voice. Okay, so this type of reflux can be known as silent reflux, as many people don't experience the heartburn symptoms that are typically associated with reflux. And these symptoms may include an unpleasant taste in the mouth, sore throat, excess mucus in the throat and difficulty clearing that, the feeling of a lump or tightness around the throat area, regular coughing and throat clearing, dryness in the mouth or throat, and a hoarse voice. So the lining of the stomach is designed to cope with acid, but the esophagus and the linings of the throat, they're not designed for that. So there's a lot of things that we can do to help this and alleviate symptoms. So this includes avoid eating late at night. Reflux is aggravated by bending, lying flat, lifting or straining. So eating before bedtime will encourage gastric backflow. So try to allow at least 3 hours between your last meal and lying down to go to sleep. Eating small, frequent meals during the day can be beneficial to distribute the physical load on the stomach and minimize the risk of reflux. Sipping water between meals can help this as well. And just taking time to sit and relax after a meal, making sure you're not up and about straight after you've finished. There are lots of foods that can make reflux worse, so avoiding these is useful. So this can include high fat foods, chocolate, prepared cakes, desserts, spicy foods, citrus fruit and mint, And food that is very hot or very cold in temperature can overstimulate the gastric musculature and increase the risk of reflux. Chewing gum can also be an irritant, and something that a lot of people find helpful is keeping a food diary to identify any particular foods or eating habits which make their symptoms worse. Fizzy drinks, caffeinated drinks, or highly acidic drinks such as fruit juice can aggravate reflux too, as can alcohol, particularly white wine and spirits. Smoking is also an irritant, and it increases your risk of developing reflux. Raising the head of the bed can be beneficial, so using pillows alone to raise your head can sort of cause your stomach to become squashed and increase the risk of reflux. So if you're planning on raising the head of your bed, it's best to put sort of blocks or bricks under your bed to raise it by about 6 inches or so. Okay. Excess weight sort of around the stomach area can encourage backflow and reflux, as can tight clothing. And I think the most important thing, if you've tried all of these sort of lifestyle changes and you're still experiencing these symptoms, it's important to speak to your GP, as they can provide more advice and perhaps prescribe some medicine to manage these symptoms. So they'll most likely prescribe a PPI or a proton pump inhibitor, and examples of this will be lansoprazole or omeprazole, just to prevent the secretion of acid into the stomach. And there's also over-the-counter medications such as Gaviscon that can be of use, but it's always important to speak to your GP about this as well. All right, so if any of this information is ringing any bells, I think the best course of action is contacting your GP, or if anything comes up in the future. You may have already seen myself or a colleague in clinic before, but if you are concerned, contacting your GP is essential. But in the meantime, strategies that can be useful are taking small, steadily paced sips of fluid or mouthfuls of diet, and trying not to talk straight after or during eating and drinking. Reducing distractions when eating and drinking, so television, radio, chatting away can be a distraction at a mealtime. If taking tablets is a bit difficult, this can be made easier by taking them with a spoonful of yogurt, for example. And as I spoke about, using a diary to detail reflux symptoms, it's also useful for noting down patterns of swallowing difficulty. Okay, so if you notice that any particular foods or drinks or scenarios commonly lead to difficulty with your swallow, then avoiding these items or environments might be of help if this is practical.